In Latin America and the Caribbean, breast cancer ranks as the first cancer type, both in terms of new cases and in terms of deaths. Here in Guyana, breast, cervical, and uterine cancers are the leading causes of death from cancers in women, says Paho WHO resident representative in Guyana, Dr. William Aducro, who noted that for the period 2003 to 2012, Guyana recorded 6,518 persons diagnosed with cancers.
For an overall cumulative incidence rate of 867 per 7 per 100,000 population, and an annual incidence rate of 87.3 per 100,000 population. Of these, 3,956, about 60%, were females, and 2,561, about 40%, were males, giving a female-to-male ratio of 60 to 40.
Dr. Aducro says breast cancer continues to directly affect the well-being of families and place substantial demand on health systems and services. That's why early detection is so important. However, regardless of how many agencies conduct free screening in this regard, it's useless unless there is effective referral and quality management, he says.
If you are going to tell someone they have a condition and you don't give them the assistance, they are going to die earlier. So please, let us do the screening. It's very important, but let's make sure that we also refer them for effective care and make sure that the care is there.
The Paho WHO resident representative explained that there is a need to strengthen health promotion and health education efforts aimed at improving awareness and understanding among women about the importance of screening and early detection of breast cancer.
Cancer spares no one. It touches the rich and it touches the poor. It touches the old, it touches the young, it touches men, women, and children. In addition to the financial cost of the disease, cancer has psychosocial repercussions for patients and their families and remains in many parts of the world a stigmatized disease. Paho WHO Guyana Country Office will continue to work with key ministries and civil society to strengthen policies and interventions aimed at reducing the incidence, morbidity, and mortality of cancer.
Meanwhile, Minister within the Ministry of Public Health, Dr. Karen Cummings, stated that data shows that cancers are slowly moving up the table to sit at the 5th leading cause of deaths in Guyana. She posited that the influx of fast food industries, lack of physical exercise, tobacco and alcohol use, and irresponsible sexual behavior do contribute to this rising toll.
It must be noted that breast and cervical cancers top the list of sites in our bodies where cancer is prevalent. Other sites include uterus, colon, rectum, and the stomach. While the percentage increases at different levels for different sites, each place in the body where cancer occurs must be treated with an equal degree of importance.
Minister Cummings explained that in Guyana, treatment and screening for cancers are somewhat limited, but this limitation does not necessarily explain the rise in the tolls. She stated that the government has begun to explore and implement numerous activities aimed at curbing this cancer epidemic.
And some of these activities include appropriate staffing of the chronic non-communicable disease unit, allotment of adequate budgetary resources, training of healthcare professionals in the area of oncology, public-private partnerships with non-governmental and non-profit organizations, research and surveys, establishment of an oncology unit at the Georgetown Public Hospital Corporation, and robust screening and preventative methods available free of cost, such as VIA, HPV and hepatitis B vaccines, HPV serological testing, and radiological services.
Reporting for HGP Nightly News, I am Kristen Macklingam.